Hi, my name's Justin Mager. I'm the community health educator for Central and Eastern Washington with the Washington Poison Center. I also serve on leadership with the Spokane Regional Opioids Task Force. Today, it's my pleasure to welcome and introduce Port Angeles Fire Department Chief Derrell Sharp. Chief Sharp is a 30-year veteran of the service with extensive training and experience in all aspects of fire department operations, emergency medical services, health and safety, and training program management. He joined the Port Angeles Fire Department as an Assistant Chief of Operations and EMS in July of 2021. Before that, Chief Sharp served Clallam County Fire District Number 3 for several years, beginning as a volunteer in 1991 and rising through the ranks to become Captain of Paramedics and Safety Officer in 2015. We are so grateful to welcome Chief Sharp today to hear about what is working in Clallam County. Chief Sharp, thank you, and please take it away.
All right. Outstanding. Well, good afternoon, everyone. Before I begin, I'd just like to take a second to sincerely thank Justin, a fellow Sequim High alumni, go Wolves, as well as all of you, members of the Spokane Regional Opioid Task Force, for the opportunity today to share a little bit about Operation Shielding Hope. It's an honor for me to share a story that's deeply personal, both to our department and to our community. So as was mentioned, my name's Derrell Sharp. I serve as the fire chief for the city of Port Angeles on Washington's, well, let's say very, very wet and rainy these last couple of days, Olympic Peninsula. Today, I want to share how one small resource-limited community united through compassion, through collaboration, and through coordination to restore dignity and to revive hope for those who are struggling with substance use disorder. Our story begins in June of 2023, when a routine review of response data had revealed that both the Port Angeles Fire Department and the Port Angeles Police Departments were responding to an average of 4 overdoses every week during that first 6 months of 2023. And I do realize that some of your agencies may see that many overdoses in a single day. But for our small, rural, resource-limited community, this was overwhelming city residents, overwhelming city resources, and overwhelming emergency services. From a resource management perspective, we learned that each overdose crews would essentially be unavailable for about 40 minutes. And that left the remaining 20,000 residents with only one available transport unit. Between January and June alone, a services analysis showed that overdose responses were costing our department more than $275,000. Additionally, we began to recognize the telltale signs of compassion fatigue and burnout in some of our providers as they encountered repeat overdoses after repeat overdoses. More concerning was the fact that over 60% of the overdose survivors were refusing treatment and transport to definitive care by our EMS providers. We also learned that there was 0% overdose survivors being referred into SUD services that were readily available throughout the county. And lastly, Clallam County had posted the 4th highest overdose fatality rate in the state at 49.3 deaths per 100,000. Yet despite everyone's best efforts across the city, the number of fatality overdoses just kept climbing. The Clallam County Health Department and a deputy coroner were already warning us that 2023 would be the worst year on record for overdose fatalities. Despite everyone's best efforts, the county had maintained a strong jail MOUD program. A broad naloxone distribution campaign was underway throughout the county. Needs-based syringe and safe smoking exchange programs were active, and new treatment access points were opening across the county. The Jamestown Healing Clinic had begun offering local medication-assisted treatment services. Olympic Peninsula Community Clinic and the North Olympic Healthcare Network both had expanded services to include substance use disorder treatment. Reflections Counseling Services had developed a peer support network. Peninsula Behavioral Health had launched its REAL teams. And all of these programs were demonstrating tremendous success rates among the individuals that they had reached and were serving. Yet, the overdose fatality and overdose rates across the city continued to climb. Police and emergency services were being stretched thin, and our fragile healthcare system was feeling the strain. By the end of 2023, Clallam County overdose fatality rate would climb to 70.7 deaths per 100,000 and become the second highest in the state. During this same time period, the Port Angeles Police Department was reporting a significant rise in property crime, a 35% increase in DUIs, and an 88% increase in drug-related cases. Olympic Medical Center was reporting significant administrations of opioid antagonists, increased prescribing of opioid antagonists at discharge, and a profound increase in positive drugs of abuse urine screens. So even with all of these efforts in motion, the data was showing that our programs were working for those who engaged. Addiction rates were still climbing, and more people were dying. And that forced us to look inward and ask ourselves a very difficult question. What are we missing? As we began to dig deeper into our local data and best practices across the nation, 3 reports stood out to us that changed our perspective. The first report came from a 2021 article in Pre-Hospital Emergency Care. And in that article, it was reported that nearly 1/3 of people who died from an accidental overdose had used 911 emergency medical services in the year before their death. Even more alarming, individuals who survived a non-fatal overdose were at a significantly higher risk of dying within the following 12 months of a repeat overdose. The second report was published by the Centers for Disease Control in 2023. And that report found that more than 3 out of 5 people who died from a drug overdose had at least one clear opportunity to be linked to care before their fatal overdose. And the third report came from our very own county health officer, who had determined that more than 78% of all of Clallam County's fatal overdoses were occurring inside the city limits of Port Angeles. So taken together, these reports painted a sobering picture. The problem wasn't a lack of opportunity to connect overdose victims with services. The problem was that those opportunities were being missed. Alarmed with this knowledge, we took a hard look at our own system, and we acknowledged that more than 3 in 5 fatal overdose victims had a chance to be connected to services before their fatal overdose. Nearly 1/3 of overdose victims had already interacted with 911 emergency services. 78% of our county's fatal overdoses were happening in our own response area. 60% of overdose survivors were refusing treatment and transport to the hospital after resuscitation. Our medic units were time constrained and needed for the next 911 call. And our firefighters, our EMTs, and our paramedics really had limited training in substance use disorders and behavioral health crisis response. And those 6 realities inspired us to reimagine what a 911 overdose response could look like in the city of Port Angeles. Around that same time, the city was notified that it would be receiving opioid settlement funding. And we saw an opportunity, a window of opportunity to try something different. We began talking with the Clallam County Health Officer, substance use disorder professionals, peer support specialists, behavioral health clinicians, recovery navigators, and harm reduction experts. Our community paramedics started spending time inside the harm reduction clinic, not as enforcers, but as partners and as learners. They built trust with people who used those services and began to see the crisis from a new point of view. By July of 2023, we had formed a working hypothesis. The widespread availability of Narcan, often being administered in varying doses, as high as 16 milligrams in numerous instances, by undertrained individuals was likely triggering precipitated withdrawal in overdose survivors. Those survivors weren't refusing care out of defiance, they were trying to escape the intense discomfort of withdrawal, and they did so the only way that they knew how to, by using again. And once we acknowledged that 911 emergency services do not have the time or the training to connect overdose survivors to available resources, once we recognized that many survivors were refusing care because they were experiencing severe withdrawal, and once we accepted that the problem wasn't that people didn't want help, it was that help wasn't meeting them where they were, we began to reimagine what a 911 overdose response could look like in the city of Port Angeles. Instead of reviving a patient and clearing the scene, the question was posed, what if we could treat withdrawal in the field? What if we could establish a rapport with overdose survivors, educate them and the witnesses on scene, and immediately connect individuals to the services and support that already are available throughout the county? What impact could a response model like that have on the opioid crisis throughout the city? Well, that question quickly became a vision, and that vision was translated into a plan. And that plan was presented as a new program, Operation Shielding Hope. With support from the city manager and the Port Angeles City Council, we began designing a proposal to use opioid settlement funds to launch a post-overdose response team, a collaboration between police, fire, and our co-response partners throughout the community, through a unified focus and goal of reducing fatal overdoses, reducing repeat overdoses, treating withdrawal symptoms in the field, restoring dignity, and connecting survivors with appropriate care at the point of crisis. In January of 2024, Port Angeles Fire Department petitioned the Washington State Department of Health for the approval of a 2-year pilot program to establish a post-overdose response unit and to expand the scope of practice for the department's 2 community paramedics. In February, the department utilized opioid settlement funding to equip the Port Angeles community paramedics with emergency response capable units. In March, the department received approval from the Department of Health to implement a post-overdose response team and the approval to expand the scope of practice for community paramedics. With DOH approval, our community paramedics began responding to all 911 dispatched overdoses while on duty. Incidentally, in March of 2024, Clallam County had recorded an overdose fatality rate of 73.3 deaths per 100,000 and continued to hold the second highest position in the state for fatal overdoses. In April, we implemented a referral program so that on-duty firefighters, EMTs, and paramedics could refer overdose survivors to the community paramedic office for all overdoses that occurred outside the community paramedics' working hours. What we quickly learned in the first few months after implementing the post-overdose response team includes many of the following. First of all, community paramedics had responded to 23 overdoses while on duty. 18 of those 23 overdose survivors accepted referrals to substance use disorder services. A greater than 78% linkage to SUD services occurred when community paramedics responded to the overdose incident and arrived on the scene and engaged the survivor. We also quickly learned that there was a pretty heavy stigma surrounding buprenorphine, which existed within the SUD community, which significantly limited the number of times that medication was administered in the field. The data began to indicate that we only had a 3% success rate of linking overdose survivors to SUD services when community paramedics were out of the office and not available to respond to the scene. And we also learned that the most critical aspect of linking overdose survivors to SUD services turned out not to be buprenorphine administration, but rather the arrival of community paramedics that were not time constrained to the next 911 call, had the ability to spend time with the patient, support the patient, educate the overdose survivor, and then facilitate a warm handoff to co-response partners throughout the community. In June of 2024, Port Angeles Fire Department received a $350,000 grant from the University of Washington and the Co-Response Outreach Alliance to further enhance and expand our co-response to behavioral health and substance use disorder incidents. And this grant enabled the department to add 2 community EMTs. These were EMTs that were already enrolled in paramedic school and in their clinical portion of the schooling. So they are now community paramedics, but we added 2 community EMTs to the office. And that addition allowed us to establish 2 autonomous post-overdose response units. And by listening to the data, we made changes to their schedule by moving them from 5 8-hour shifts to 4 10-hour shifts. This enabled us to have at least 1 post-overdose response unit available Monday through Friday, and to cover the hours from 4 p.m. to 6 p.m., which the data had been showing us was identified as one of the peak overdose timeframes within our community. By embracing acute overdoses as opportunities to link survivors to SUD and behavioral health services at the point of crisis, by sending resources that are not constrained by the next 911 call for service, by expanding the scope of practice to include the administration of buprenorphine for overdose survivors experiencing precipitated withdrawal, and by looking at data to drive decisions, Clallam County overdose fatality rates began to drop. From January of 2024 to January of 2025, Clallam County dropped from the 2nd highest overdose fatality rate to the 10th, with a reduction of fatal overdoses from 73.3 deaths per 100,000 to 41.2 deaths per 100,000. From March of 2024 to April of 2025, 12 months after the implementation of Operation Shielding Hope and the post-overdose response team, Clallam County fell to 13th in the state, with an overdose fatality rate of 28.3 deaths per 100,000. And that represents a 61.4% decrease in fatal overdoses in 1 year. What we have learned through the success of Operation Shielding Hope is that clinics and treatment centers remain absolutely essential for long-term recovery. But not every individual struggling with addiction will find the courage or the readiness to walk through those doors on their own. For many, the healthcare system can feel like a maze, overwhelming and hard to navigate, especially for those living with substance use and behavioral health disorders. And that's why peer support specialists, recovery navigators, and social services personnel are such critical partners in this work. They meet people where they are and help them take the next steps to recovery. And while those community-based services are vital, the reality, at least for us on the Olympic Peninsula, is that 911 will continue to be the primary entry point into the system for most overdose survivors. An overdose is witnessed, and the reaction is to call 911. Dispatch's response is to dispatch fire and law enforcement. So even though emergency medical technicians and paramedics are incredibly skilled at recognizing and treating life-threatening conditions, our experience has shown us that our traditional training programs don't adequately prepare them for behavioral health and substance use challenges which they're facing on a daily basis. And that's where the post-overdose response team can really make a difference. By combining the clinical expertise of EMS with the lived experience and advocacy of behavioral health partners, we have the greatest opportunity to connect survivors to care, not someday, but at the very moment and point of crisis. That's the heart of Operation Shielding Hope. Compassion and coordination at the point of impact to restore dignity and revive hope when people need it most. What truly brings Operation Shielding Hope to life isn't policy or funding, it's the people. Our 4 community paramedics are the heart of this work. And this type of response isn't for everyone. It takes a special kind of person to do what they do, to walk into situations filled with pain and despair and uncertainty and respond with compassion, patience, and respect. These medics have a calling for this work. They sit down on wet sidewalks in the rain to talk with an overdose survivor. They sit at kitchen tables with families who are scared and exhausted. They wait in hospital rooms, advocate at bedside, and reassure people that they matter and that recovery is possible. They bring clinical skill, but more importantly, they bring heart. They see people, not as patients, not as cases, but as human beings who deserve another chance at life. Their compassion, their consistency, and their willingness to show up again and again are what truly make this program successful. They don't just represent the Port Angeles Fire Department, they represent what's best about public service, empathy, advocacy, and hope in action. One of the most profound outcomes of Operation Shielding Hope, besides the reduction in fatal overdose and the reduction in repeat overdoses and the reduction of utilization of 911 emergency services and the emergency department, is that Operation Shielding Hope has had a tremendous impact on our own firefighters, paramedics, and EMTs. When this crisis was at its peak, compassion fatigue and burnout were real. Crews were responding to the same addresses, the same faces, week after week, and it felt like nothing was changing. It was exhausting, both emotionally and mentally for them. But today, that's different. Morale is at an all-time high. Our responders know that when they arrive at an overdose, the community paramedics are right behind them, ready to step in, ready to support the survivor, and ready to connect them to the real help that's available within our community. They no longer expect to see the same person over and over again. They've seen what recovery looks like, and they believe in it. Now, when an overdose happens and the community paramedics aren't available, our crews simply collect contact information, explain that someone from the team will reach out within 48 hours, and that simple act restores hope for both the patient and the responder. Every referral they make is meaningful because they know it will be followed up. They know someone will make that call, someone will knock on that door, or meet that person where they are. This program hasn't just changed outcomes in our community, it's changed our department. It has redefined what success looks like for the firefighter, for the EMT, for the paramedic, and for the overdose survivor. They see now that every overdose call is not a repeat failure. It's another opportunity to connect a customer to recovery services. I thought as we near the end of the presentation, we might take a look at what a post-overdose response team call looks like. So an acute overdose is called into 911 dispatch center. Fire, EMS, and law enforcement are dispatched to the scene. Often, a bystander or an early arriving police officer has already administered Narcan before our arrival, and the individual has been resuscitated. If not, obviously our crews will take over life-saving measures, working as one unified team. Once the scene is stable, the community paramedics step forward to take lead. If the patient is transported, the port team meets that patient at the hospital, advocates for them at their bedside, and begins connecting them with recovery services. They reach out to our co-response partners to ensure a warm handoff to substance use or behavioral health professionals. If the patient refuses transport and the situation is stable, the port team releases fire, EMS, and law enforcement to go available to respond to the next emergency call for assistance. And they stay behind, sitting with the survivor, educating them, assessing for precipitated withdrawal, offering buprenorphine if appropriate, and obtaining consent to connect them with care services. Each month, the team meets with our co-response partners to review cases, share lessons, and strengthen collaboration. They also provide HIPAA-compliant follow-up information to the original first responders to close the loop and let them know the outcome of the people that they've helped. It's a cycle of care that turns a single 911 call into a bridge toward recovery, one that starts with compassion, continues with connection, and ends with hope.